Yes. So, good evening, dear doctors. Thank you all for joining in on time, especially. So, today we are having an orientation session on postgraduate diploma in Ayurveda nutrition, and we are proudly saying this is going to be our fifth batch. So, let me set the context here and keep it very casual and easy for us to communicate. So since this is fifth batch we are talking about, and we have had four successful batch and fourth batch is ongoing. I would like to start by focusing on why we focus and why we are stressing much on Ayurveda nutrition. I know we all are excellent practitioners who are present over here. Few of them might have just completed the BMS. Few are being practicing for a long period, I could say, with excellent clinical skills, we can say. But the problem here is in today's landscape, clinical landscape, we know that Ayurveda practitioners are called upon mostly to offer something more evidence based, and they call it with the name personalized nutrition guidance, right? And the patients who come to us in our clinics, let it be through the online mode, offline mode, or you work in a hospital, anywhere, if you take the personality or the character of the patients nowadays, it is like they are more informed, right? They are more curious, they are more updating, and they are more demanding. It is not that they will settle for anything what you offer. Since they have a lot of information at the fingertips, they are more demanding nowadays. But yet, in spite of all this, our dietary wisdom, Ayurveda's dietary wisdom, still lack a structured training. As a practitioner myself, I'm very well aware of this. We lack a structured training in applying this nutrition therapeutically, right? So what happens? And this gap often, how does it result in? What does this gap lead to? It leads to a situation where we end up prescribing very generic diet, right? Example, if a patient is of diabetes, say prameha, you only know to say that we quote the modern terminology, use a low glycemic index food, right? At the most, we will say kapha vriddhikara ahara we should avoid, right? Those help to worsen your metabolic condition, you should avoid. We just name or something, cut down your sugar, cut down this. We just give something very generic. We are not focusing on a prakriti specific nuances, right? We give our prescription, and obviously the patient will ask us, doctor, is there something specific dietary preference you would like me to follow in this particular condition? It is not limiting just to diabetes. Take up any condition. Go with the thyroid, you go with liver disorders, you go with PCOS, you go with obesity. Right from your gut health and gut reset nowadays is working too much. So everyone come and ask you to focus. Doc, can you specifically say something? Because generic diet, they find it everywhere. They find it in n number of AIs currently available. They find it in just by Googling, they get it right. So always they demand, can you give something very personalized for me? And we miss this opportunity just by giving a generic diet. Once they see a generic diet, they think, okay, this is what the maximum I can get from this doctor with a consultation. Let me go somewhere else where I can be very tailored thing I can get it. Okay. So this limited integration of modern nutritional science with Ayurvedic principles miss and we also miss the opportunity for innovative product and preventive care. And this is where postgraduate diploma in Ayurveda nutrition becomes not just relevant for this era, but a very essential component for an Ayurveda practitioner. So on that simple note, I just dragged little, but I wanted you to get the context why we are setting up this orientation. So on that note, I warmly welcome you all to the orientation session of fifth batch of PGDAN. And I am Dr. Lipi Viraju. I'm working as an in an integrated platform as a clinical specialist in metabolic disorder, and I'm the academic coordinator and faculty for the PGDAN fifth batch. So let me quickly take you through some of the 1 second. Yes. Let me quickly take you through this MedBack medical services. What do we provide and how this entire thing has happened. So MedMap services and Ayurveda Map is more than just any educational platform. You might have seen education platform a lot there who provide specialized diploma courses, short-term courses, etc. But rather than calling it an educational platform, we would like to call it a movement. Why? Because we support Ayurveda doctors by blending the traditional wisdom with modern tools. We take the most updated things going on, whether it be functional medicine, lifestyle medicine, whether it be personalized nutrition, sports medicine, let marma vidya, let it be anything. We try to bring it together with the modern tools. So our goal is to nurture better practitioners, better healers who are not just skilled but also compassionate, ethical, and who are globally aware. So if you are here, you're already a part of this specific vision. So, just a very small glimpse of our founder and director, Dr. Jasul Alingar. So, it was founded by Dr. Jasul Alingar, a visionary in the integrated healthcare platform, as you all know. He has been mentored by some of the most respected names in Ayurveda and is deeply committed to structured learning and mentorship. And MedMap is all about bridging this Ayurveda and modern medicine, and this course is a perfect example of that. So our vision is very simple to help the aspiring Ayurveda Vaidyas grow professionally. And we offer diploma programs in high demand areas as this is for PGDAN Ayurveda Nutrition. This is one of our flagship courses among multiple Stanik Chikalsa courses, antenatal courses, postnatal courses, among all that cosmetology courses. This is one of our flagship courses. And whether you are here to deepen your clinical practice or explore your nutrition from an Ayurvedic lens, I would definitely say that you have found the right place for that. So let me give you a very brief about a program overview, I can say. You will hear about other offerings as we go, what are our other short-term courses. But today our focus is on PGDA. So this course has evolved over the years, okay? And as you know, this is fifth batch. It is packed with new insights and practical tools. We take feedbacks from every session. Every batch we get the feedback. If we need to update something, if we need to tailor our syllabus a little more, if we need to cater any specific needs of the students, we address that in each batch. And this fifth batch is going to have a lot of new insights and practical tools. So, and this program and this specific course is close to my heart, not just because I'm an educator and a practitioner, but as a clinician who sees that firsthand how deeply nutrition impact patient outcome. This I have seen in my personal practice as well. So this course always stand close to my heart. And this program is designed to empower your expertise in Ayurveda-based nutrition and dietetics. So you all would be wondering by now what I'm going to learn from this. When you say Ayurveda nutrition, what exactly do you cover here, right? So I assure that by end of this course, you will be able to understand both the Ayurveda nutrition and modern nutrition principles. And not just understand it as two different entities, but how to combinedly use it or utilize it in an integrated platform. And you can apply this dietetics clinically, create therapeutic recipes, and guide others towards most holistic wellness. So I can say that it is a well-rounded curriculum that prepares you for practice and innovation. So let me give a brief of what are the headings to be covered and what are the different sessions you will be going through, because understanding the syllabus is very much important before committing to a course. I know that very well. So let me give you a brief. So here's a quick look at what we will cover. We'll be having a basic nutrition, Ayurveda physiology, nutrition across life stages, clinical and sports nutrition, and even food design and nutraceuticals. Let me take you through one by one. So always this class start with the foundation, because most of them may be aware about what is nutrition, what is the modern principle, everything. You during your UG or PG time, or after that you might have read some books and you gained the knowledge. But we would like to start the session with the foundation. Foundation includes giving you a glimpse of the nutrition and its concepts in the modern view. And always we know that human physiology, understanding human physiology, both modern and Ayurvedic way, and correlating it is very much important to understand any nutritional topic, because we need to know once this is learned how it is going to act in our body. So we give you a brief about the human physiology and then move into the nutrition and dietetics in Samhitas. When anyone asks you where exactly this nutrition is mentioned, most of us will tend to say Ahara Vargas. But just think to yourself, how many of you really know what does the Ahara Varga explain very detailed in our classics contain? Many knows the name, many knows a few of it, many knows, some of you might know their what exactly their dosha, karma, everything, guna is, right? So what next we focus is on different types of ahara varga. We take it part by part, one by one, starting from Shukadanya, Shimpidanya, we go with every Phala varga, Kshira varga, Mamsa varga, Taila varga, everything. Not just covering it as per the Samhita. Let me give you a very frank opinion. We won't be covering it as per the Samhita very theoretically, because we know we are not here to prepare for any competitive exam. We are here to apply it practically. So how this session will be catered to you is, suppose you take a specific Ahara Varga, understand what are the currently available food ingredients out of that, and note down, make a note of what are its dosha, guna, karma, etc., and how it is practically utilized in current scenario. This way we will be splitting the Ahara Varga topic. And then we will move to the applied nutrition. This is where you exactly learn how to apply nutrition to different life stages. Let me say we'll start from the infant nutrition, moving ahead with a pediatric, adolescent, adult, geriatric. Then we will go to specialized area of post-antenatal and postnatal nutrition, right? Then to sports and rehabilitation. So during different life stages, women's health especially, during these life stages, how nutrition should be prescribed, how tailored it should be, that will be taken in the next step. Then most importantly, moving to how to prescribe a diet in an integrated way, and most important, how to give a diet counseling. It is very I will say that tiresome job to make someone understand the importance of food and how that tailoring their food choices can impact their health. This is very important, because without giving, in my personal practice also I have seen, without giving a clear diet counseling to a patient, no one commit for a diet consultation. See, that let me come to diet consultation later on. And then we'll go to another interesting areas, food-drug interaction and nutrient-nutrient interaction. This is where the Viruddhahara topic comes up, but not again, I'm saying it is not going to be the theoretical Viruddhahara which you learned. We know there are many things which are not currently anyone has seen or noticed or doing it. But we pick up what is the current scenario Viruddhahara where we should apply, where we should advise the patient, and nutrient-nutrient interaction, how important it is. This would be covered mostly by Ayurveda biologists who are specialized on these areas, not just some random faculties. Okay. And then we will move to more advanced concepts, which includes global food practices. Here, globally now, most of the doctors who are practicing online consultations, they cater this, not just the doctors, institutions, everyone, they cater their service mostly to the UK clients, USA clients, Canada clients, I can see. So how this global food practices, most of the time the ingredients list or something we make here is not going to apply over that market, right? So we give you a glimpse of how global food practices is, what are the ingredients specifically you should know when you try to understand a dietary behavior, because you can't just give our current diet pattern to someone living in UK, right? You need to understand the things available there, the season, based on that season, how they consume the food, everything matters. So a global awareness would be given, and then we'll move to a nutraceutical nutrigenomics topic. Most emerging topic, I can say. This will be taken by a faculty who is currently focused on the nutraceutical part, preparing new innovative products. Then you will have classes on food hygiene, food supplement designs. These are the most advanced concepts I can say which you will be given, but not the theoretically. Again, saying how along with the theory, because you need to understand the basics of course. But along with that, we can teach you how different recipes are being created, how to understand its caloric value, how to which condition you should give, which dosha predominance you should give. These things will be discussed. And finally, you will have a practical recipe and design using Ayurveda. This will be mostly an offline session where you will have a group discussions, you will have offline in-hand training, etc. So this is about the syllabus overview. There is much more detailing into it. But since this is an orientation class, I wanted to give you an idea on how wide the topics are covered. When you think of Ayurveda nutrition, don't think that we will be just saying about only the Ashtahara or any Ahara Varga, that's all. No, that is not the matter. It is going to be a very well covered, very thoughtfully curated syllabus you're getting. Now let me move to our program features. Many of you will be having doubts since you're joining from different parts of India. Many of you would be having doubts how this program is going to be, what is the pattern of. So let me tell you, this is going to be online and offline, a hybrid learning. But it doesn't mean that you will have to on and off come and travel and attend. It is not like that. Once the class starts until the end of the course, say like a 1 month before the exam or one just half month before the exam, every classes are going to be scheduled online. Every session will be online and you will be have weekly one classes you will be having. Mostly our sessions would be during the evening time, 7:30 as this. And after completing the entire online classes, during the time of exam, you will have to come over to Calicut because exam is offline. You will have to come in person. It is not an online exam. You will have to come in person. Mostly the exam center is in Calicut, Kerala. And during that time, prior to the exam, you will be having in-hand workshop, right? Where various specialists and faculties come over and teach you various dietary preparations and recipes. And you will have case discussion, group discussion, assignments where you will be actively, you can actually take your view, you can discuss different cases assigned for you. So this would be collaboration before the exam, I can say. You have a very hands-on training and discussion with the faculty, and then the exams and other formalities. So now let me give you a brief of faculties, how all are going to teach you, what are the areas, because it is always, I know it is always interesting, and before committing to something, we need to know that who is going to guide me, who is going to be with me in this journey, right? So first, when I said about the physiological aspects, everything, Dr. Shabil Abdine, who is a very eminent faculty in Ayurveda, he would be dealing Ayurvedic physiology portion, which is specific to digestion, metabolism, and nutritional aspect. Then we are having Dr. Mumtaz Khalid ma'am. Ma'am is a modern nutritionist. She will start with the basics of the nutrition for you. And everyone might be knowing Dr. Kashinath Samagadi sir. He's a very, very famous and eminent faculty in our institute as well. He's taking his complete core focus is Ahara Varga, not just theoretically. He literally tells us currently what we have to take, what we have not to take, and what are the specific guna, karma, etc. We have Dr. Geeta Dharmatima. Ma'am is a modern nutritionist and she would be covering different lifestyle of nutrition. Let me tell you, all our faculties are very cooperative. They answer any questions because most of the sessions we are having at least 30 to 35 minutes of discussion happens in most of the sessions towards the end, and they patiently give an answer to any of your question. Let it be a clinical question, clinically faced condition related to diet you're having. Ma'am, this was a case which came to me. I prescribed like this. So what are your thoughts? So these 1 year entirely you get a chance to communicate thoroughly with this doctors. Okay. So with that, you can incorporate their ideas as well in your practice. And we have Dr. Valsala Devi ma'am. She is a visionary and she has much expertise in Ayurvedic cookery and she takes more classes related to the Ayurveda dietetics. And when I said about new emerging topics like nutraceuticals, nutrigenomics, food innovations, the right faculty for that is Dr. Niyati Shivan, who would be with us for that. And since the last batch onwards, we have added 3 more expert faculty, let me say, in our field. So one is Dr. Nikhila Hiramat. She works in a global platform where she prescribes diet to global audience, specifically US audience. But they have a very specific method of prescribing it as per the doshas, as per conditions, what is patya, what is apatya, and with recipes. Okay, so ma'am would take us through the dietetic principles, case discussion, etc., and how to apply it globally. And we have Dr. Neetu C. Mohan, who is again an expert. She would be teaching us the dietetic principles in most of the gut disorders, then coming to thyroid disorders and liver specifically. And very interestingly, we have Megha ma'am. She's an Ayurveda biologist, associate professor at TDU, and ma'am would be giving more thoughts, insights into nutrient interaction and Viruddhahara. And when you get these thoughts from an Ayurveda biologist, the view is going to be entirely different, because as BMS doctors, Ayurveda doctors, what we learned and how we see upon certain things is completely different when from the lens of Ayurveda biologist. So she would be taking us through a different level of understanding these concepts, I can say. So you will be, I assure you, you will be having a mentorship-driven guidance throughout this course as well. So you all may be wondering what is the course fee and what are the other offerings. So the total course fee is 36,500. But we do have some great offers as well, like to say. So there is 10% off on full payment within 2 weeks. That is, you will have to pay only 32,850. And extra 2% off for Ayurveda MAP alumni, whoever have taken up any of the other courses like cosmetology course or Panchakarma course, they will be having an additional 2% off as well. And there is EMI option. You can pay 10,000 at joining and 5,300 as 5 EMIs. So it is totally payable in 6 months. But please note that this is valid only until the course start, and the terms can change after the commencement, right? So it is always inspiring to see how far our students go. So these are few of the photos I have attached here, just so that you understand. We do have a validatory function after the exams, up towards the end, where we address our students, understand, get to know them better in person. They share their feedbacks, and many of them now lead their own wellness practices or contribute to research and education as well. And many are doing their own self practice. Few are doing online, offline, and we are part of much of the integrated platforms nowadays. So, just giving you a glimpse of few of our photographs. These are the photos of our practical enhanced session which is happening, which will be happening at Calicut towards the end. So let me take a pause here. I want to say that don't just take our words for it, but our alumni have shared some heartfelt testimonials about how PGDAN has transformed their approach to healing and nutrition. So I'm sharing few of this here. Let me play the video, and you can watch it yourself. Let me play one more testimonial for you.
Dr. Lidki, it is not audible. Dr. Lidki, it is not audible.
Yes. So I think these just two, due to the lack of time, we have attached two testimonials here. But I do want to say that there are a number of students who have benefited from our courses, who are practicing very well. And now, if you ask me, Doctor, what are the career opportunities, or how else can I practice just by learning this or getting this diploma degree? If you ask me, I can say that career opportunities include, especially in your clinic, you can add like a personalized diet consultation. This is going to be one of your specialty. You can add it in your description. You can add it in your what do you say, bio, wherever you give it, and specialize. I won't say that obviously you'll be practicing in something very much specific. Some would be metabolic disorders, some would be for neurology care, some would be specifically for joint and arthritic condition, some are for dermatology, right? So give something like, you can always keep something like personalized diet consultation is something, it is a part of your clinical practice. Along with handing over a clinical prescription, keep an attachment where you give a personalized diet consultation chart, and you can charge as per that. And since we know that lifestyle and preventive healthcare is the most emerging field, their work in the preventive healthcare programs focusing on dinacharya, ritucharya, weight management, stress management, and healthy aging. You can combine all this, and as if you can start a different branch itself, I will say, like a lifestyle and preventive healthcare branch where you promote, along with learning this diet, you can try to correct their lifestyle, can give them preventive health tips based on seasonal changes, right? So that is one another opportunity. You can build your own online consultation models. Currently, if you ask most of the doctors who are passed out, along with practicing in our own hometown, most of them who have built their own website, or those who have their own collaborations, they do online consultation models. It can be a flexible digital consultation practice through telemedicine platforms, wellness app, anywhere it is. And most importantly, you can collaborate, because most of the hospitals today, if you look, they have integrated brands, right? So there, if you're a person who is very much active in LinkedIn, there are multiple wellness centers, wellness clinics, hospitals. They actively look for a doctor, Ayurveda doctor, who have great knowledge in nutrition, and few would be demanding, especially in postpartum care, gynecological care, or whether it be pediatric care. So they would be saying a nutrition specific in these conditions. So you can easily keep up your bio, update your bio, and apply for all these corporate and wellness programs. And you can design employee wellness program, like, most of the doctors, we are called upon for talks, right? So we can employ or design our own wellness program, detox plan, workplace nutrition initiative. These are the things even I currently do. Then we have women and child wellness specialization sessions. There is a wide need for expertise in maternal nutrition, fertility care, pediatric nutrition, postpartum care, and hormonal health. If you are going to learn along with this course, if you give your focus a little more on the woman's health, you can excel at this field. And if you're a person who is self-practicing, an additional bonus to you. And if you're going to apply for any institute, this is going to be a bonus where you can put in your resume and get selected in the dietary field as well. So, and global scope includes, because let me say, now there are a few companies, a few of the name I would like to take us, Nirva Healthcare is there, Livia Best Life Healthcare is there. These are the areas, these are few of the companies, just mentioning few areas. They are taking this Ayurveda doctors who are in India and catering our services worldwide. I really take the name worldwide because they need our expertise, they need our thorough knowledge in nutrition. If you are a person who is having Ayurveda focus along with a nutrition addition, along with a yoga, very well better. So keep on updating this to get enrolled for such companies as well. And upon this note, I'm taking a small break for PGDAN. Let me walk you through what are the other courses we provide through MedMac Medical Services. One is Thanik Chikitsa in Striroga. So this is going to be a 3 months course plus 4-day intense clinical offline training is provided at SDM College, Udupi. We have diploma in antenatal and postnatal care in Ayurveda. We have a 6-month exclusive online training program in Diploma in Ayurveda Cardiology. You can see how wide these areas are being covered. It is not just the nutrition, the other services, other programs we provide. Actually, this doesn't emerge over the night, okay? After getting demands from multiple doctors, after collecting feedbacks, and then understanding the need of our various doctors, these courses are being curated. And we have professional diploma in Ayurveda Panchadharma, a very demanding course where a lot of enrollments happen. And most importantly, we have postgraduate diploma in cosmetology and trichology. Here you can see a number of doctors have enrolled, many have practiced, they have started their cosmetology brand, you have started their cosmetology product making, everything. So very accepted and useful area for all the BMS doctors who have passed out. And there is professional diploma in sports medicine and rehabilitation as well. This is also a 6-month intensive program designed for the working BMS doctors. That builds a musculoskeletal health. It is led by musculoskeletal health expertise patients as well. And if you ask me about the short-term courses, these all were the 6 months courses. But if you ask me short-term courses, we have Sandhana, an integrative approach to sports medicine. There is Marma Vidhi, which will be mostly commencing by June 13 and 14, where it is going to be a 2-day residential program. For whoever is interested in these can easily enroll by looking into this numbers. You can call up to MedMap services and post your queries there. So yes, so this was all about the PGDAN orientation I could give you and explained about all the long-term and short-term courses we have. And if you have any questions or need any support, I think most of you have been added to a specific group. So our team is here for you. You can either reach us via the mail ID given here or the WhatsApp number or the contact number provided here or directly through our website. And you can read more about our website as well. So we are a company based in Calicut, but our community spans across India and beyond. So always a very trained team is here to always help you and support you and to answer any of your queries. So thank you so much for your time. Now let us take this time for active discussion. I know many of you will be having doubts or you would like to clear something, so please feel free to take this opportunity to clear your doubts and ask more if you want to do anything. Thank you so much. Sorry, since I was sharing the screen, I didn't see the messages in the chat box. Was the testimonial not audible? I'm so sorry. Someone could have just informed me. Is anyone there in the call? Yeah. Dear doctor, so sorry if you couldn't hear the testimonials. Can you say, was the testimonial part not audible or was my session not audible? Can anyone please reply? I think Dr. Hariharan and Dr. Akila Devi has posted. Doctors, was the testimonial part not audible to you? Testimonial. Okay, you presented not audible. Okay, so sorry for that. Let me try sharing again. Meanwhile, sound. 1 second. I'm sharing again. I'm resharing again. So sorry for that. Someone could have informed me. Then it would not have happened because since I was sharing the screen, I couldn't completely see the chat box there. So sorry. Let me try sharing it again. And please let me know by unmuting if it is audible or not. Okay.
I'm an RD doctor, so I travel.
Is it audible? I just posted it now. Is it audible?
Around a lot. Most of the doctors.
Hello. Can someone please reply? Unmute and reply. Is it audible, Dr. Jasul? Can you reply, please?
Yes, doctor.
Okay.
They don't think about diet. They just prescribe medications and then they think that's it. And when I started listening to the classes, either I learned something new or I understood the old thing even better. And I especially enjoyed Dr. Kashinath's class very well, and ma'am, your class too. And I want to thank the faculties for keeping us in touch either online and offline. All the training sessions were also very useful and interactive. I reluctantly joined the course, but now if I had missed it, I would have regretted it. But thank you, Dad. and thank you to the faculties.
Good evening, everyone. I'm Dr. Vedapriya. I'm from Bangalore, working as a consultant in a government sector. Our prescription doesn't go with, explaining patya patya to a patient. Even if we do not advise, patient themselves will ask, is there any patya to be followed along with our medicines? So I thought of, adding more knowledge so that we can quantify what we are advising instead of vaguely advising the patient what to take, what not to take. So I thank Ayurveda MAP for arranging high profile faculties to enhance our knowledge. Thank you.
Yeah, that was the testimonial part. If you have any questions, please feel to unmute. And Dr. Cecil, please, can you please add something more if I have missed anything or to explain something? Please go ahead.
Good evening, doctors. Yes, it was a very elaborate presentation in which you covered everything. Thank you for that. And yes, so we hope in today's session already joined participants and new participants are also joined. So those who already joined, just put M in the chat box. Just put me in the chat box. Those who already joined.
Dr. Jassal, there's a question from Dr. Preeti. Is it a government authorized course? So you can answer on that.
Okay. Let me discuss this. Okay.
Dr. Hariharan has joined. Thank you for letting us know.
Okay.
Else?
Yes, any others who already joined?
Manisha, Dr. Manisha has joined.
Okay. Good. So this course actually, we have at the starting time, in the first batch itself, it was only around 50 people was there. In the last batch, we had around 100 people joined in the last batch. So that is because of the referrals and the suggestions from the previous batch students, like how they got benefited from this course. So I'm very thankful for our previous students and current students. Maybe you may be referred by our previous students because they got much benefited from our platform. And some of you may be new to the Ayurveda or a fresher, or maybe some of you may be had a career break, or that doesn't matter. So, if you are interested to practice or interested to grow, or you like a mentality to grow in your area, you have a lot of ways, and we will help you regarding that. And so many doctors who right now not practicing, not definitely practicing because of their family issues, maybe their career, or they will be traveling to different areas, or residing in different areas where the practice is somewhat difficult. For them, this course is this course will be very useful to them, in which they do, as Dr. Litti mentioned, they can practice or bring their career into next level with the online consultations. as right now, as Dr. Litti mentioned, there are a lot of specifications in the online diet consultations itself. So this is the basic course and basic to intermediate course in which you can do the specific things in your niche. Also, mm, there are a lot of areas in Ayurveda nutrition in which you can shine well. The difference between the other courses is like they will teach the nutrition part, modern nutrition part well, but not in the Ayurvedic way, or not in the way you like the people need. People need specific things. People need specific answers. So, you must have a clarity regarding what the modern nutrition do in a specific thing and what Ayurveda can do. So, we will help you to get that knowledge in this course. So, we will have both the faculties, like modern nutrition part, Ayurveda nutrition part. So, you will have the clarity. At the end of the course, you will have the clarity regarding where to position your career, as well as how to convince your patients. And regarding what the question is, Dr. Litti, what actually the question?
Is it a government certified course, authorized course?
This this is a skill development course. Okay, definitely this is a skill course. This is affiliated to National Skill Development Corporation. The academic courses and skill courses are different. Okay, academic courses include your degree, PG, PhD, that is the academic courses. Skill courses means skill platforms are different, in which you will be doing diploma, PG diplomas, etc. So that is the skill courses. Okay, so we are affiliated to National Skill Development under the ministry. And also for the interested people, we are offering from this batch onwards, we are offering fellowship in Ayurveda nutrition course. So affiliated by RAV, ATAB, Ayurveda Training Accreditation Board under Ministry of Ayush. So we are accredited to Ministry of Ayush, and we'll be providing, we will be having separate exams, separate means guidelines for that RAV also. That for interested people, they can do write the exams, and they can go for their specifications, and you can earn another certificate with this same course you will be doing, but do some another activities, and you can earn the ATAB certificate, that ATAB accredited certificate. Okay, that also you can do from this course, and you will get embassy attestation, and if you want to do like a registration in employment exchanges through this certificate, you can go. Yes, any other clarifications needed? Yes, Dr. Litti, any clarifications needed?
If you have any doubts, doctors, please feel free to ask here itself. I think most of the points we have covered. Dr. Jasser also covered about the fellowship program and how we can enroll as well. And what in this from the previous 4 batches, what one common thing I have observed is, I would like to share it here is, most of the doctors who are coming back after a career break, like as Dr. Jasul said, mostly after a maternity leave or after having kids, and after 2 years they might not have been able to cope up with the real practice. So just as a real push or inspiration to come up with something very specific core to their area, rather than just putting upon just prescription. This have really helped them, given them the confidence to face the our Ayurvedic practitioners and fraternity, I can say, and along with that, to boost their real practice. Those schools have helped them a lot in this case, I can say. And one another additional benefit, I don't say, but throughout the course, you have the opportunity to communicate with the doctors if you have any doubts related to your clinical practice, whether it be prescribing or a condition. Entire faculty will be together with us. You have any queries, you can either contact directly or give it to us, and we will be communicating with them and resolving all your queries in every session. Okay, nothing is kept on hold until now. So there is a question from Dr. Monisha. Is this NSDC accreditation be valid in abroad countries? Dr. Jasu. In abroad, how it is?
Okay. So in abroad countries, any countries, you can get embassy attestation. Okay. And regarding the validation, like this is like a postgraduate diploma. So your graduation is more important. Okay. If BAMS is valid in any country, your diploma is also valid. Okay. So so you can practice in any countries where the BAMS is valid. That is the core degree, your degree. Okay. Uh, so so without your degree, this certificate will not have an independent validity. That depends upon the country, specific country, and the validity of the BAMS there.
And always consider this an upskilling course. Okay, we always have to keep on updating ourselves, whether it be through the current emerging AI. Now you know there are various courses linking Ayurveda and AI. If you see recently, so Central Board of Commerce is providing a course, online course it is, that is linking Ayurveda and AI, specifically for Ayurveda doctors. Okay, this is a certain course, because to survive in this community, I will say currently, how much more updation you get, how much more specialized knowledge you get, that is where you stand different. You are recognized, you are respected, and the traditional practice of seeing the patient and just giving one kashaya, one tablet, one churna, that era is coming to almost an end now, we can say. As I really said, this course teaches you to be very specific. Okay, nowadays everyone is demanding for this personalized and tailored. You give me something very specific for me, not the same thing. If you go to Cloud AI and just put in the condition, now Cloud AI even give the prescription and diagnosis. Okay, you give your 5 symptoms. Cloud AI is currently giving you, this is the Ayurveda diagnosis, Amla Pitta. This is an Amla Pitta condition. This is the dosha aggravation here, and this. So if you have to survive in this world, you really should have that knowledge in your head, right? Okay. Okay, millets are said. Is it said in the classics? Yes. If it is said, means what are the qualities? Can everyone go with millets? Should it be specifically given to certain metabolic conditions? Okay, if you are prescribing palak paneer, and along with it, you are saying that you need to have iron intake more. You have to, the patient should have more HP. Will it happen? No, because palak and paneer, two things. There is nutrient interaction there. It will obviously hamper the iron absorption. So these are the things which we should know, and we should educate the client. Then they will think that yes, this doctor knows something different than others. I can approach them. Our style of consultation, the way we counsel our client, that is why I said more than consultation, diet counseling is very, very important. And we have super special faculties who would be taking your class just about diet counseling as well. Yes, coming to another question, ma'am, will notes or PDFs are provided in this? Yes. very certainly you will have, after every session, the concerned session notes will be uploaded in the website, which you will be having access. Every notes are provided to you, and along with that, we will be printing out a complete module of the entire session, and a booklet will be sent across to you before the exam. So you can refer it in hand, you can refer it, and anytime in your computer, laptop, tab, phone, anywhere you can access it as well. The complete end-to-end notes will be provided. There is a clear transparency in that, okay, and the recordings, everything will be there. But always we encourage the students, and until most of them are doing it also, everyone take up the live session. So the benefit is you get to interact really with that doctors, okay. And I'm not overwhelming it or exaggerating it and saying, but in the fourth batch, which is currently ongoing, you can see how actively the doctors are putting up the queries. I can see that in 1 week a session gets over. Suppose say that next week the topic is going to be, say it is on geriatric nutrition. So 1 month before we would be giving the schedule. Doctors, next month, these are the 4 to 5 sessions you are going to have, and these are the faculties who is going to take. So I have, most surprisingly, I have seen that these doctors come prepared after every week in their clinic. What they have, what cases they have seen in relation to this, they take it up as a case study and come and discuss towards the end, and faculties clear it. So during the follow-up visit of that client, this doctor can give a very well curated diet plan. Surprisingly, so this happens only in live sessions. Okay, if you go for any recording, send the query, in that what happens, there is a lag. So to get a real scenario discussion, active discussion, always attend the live sessions. And this time in our fourth batch, we have doctors from UK attending, from Oman. In spite of the time difference, they are attending it regularly. These are the things which keeps us on moving, and thought of bringing up the fifth batch. Okay, so every batch, this batch, as Doctor said, 100, let me say 110 enrollments we are having on this fourth batch which we are having. And super active students, super active doctors, and few are having experience of even 30 to 35 years of clinical expertise. So just think about their age and still how interested they are to update their knowledge. So without updating our skill, without upskilling, survival is not going to be possible. This is something we all know. This is a harsh reality, but we should welcome new updates. We should try to merge in and learn. Any more questions? I would like to answer it completely. Myself and Dr. Grisel are here for answering any of your queries. When I said every session would be practical oriented, to add to that, we have our basic session also, because as I said, without understanding physiology, you can't understand rest of the thoughts. So we are having the theoretical aspect as well. We are not completely skipping it, okay? And that is necessary for explaining it to any of your patients. You should first understand the theory, then how this is going to be practically applied. So both the sessions are going hand in hand, but we make sure not to keep it boring, keep the sessions active, and bring in more discussion points.
Yes, 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 absolutely. And those who joined, can you introduce yourself, like why you joined this course, and what are you expecting?
Yeah, it would be great to know what are your expectations, what do you like to achieve by this course, or what are your goals, if you would say. We can also evaluate, is it coping up with our current schedule, and is it meeting your expectation you would like to.
Yes, we have no language barrier. You can.
Any language you can, either English, Malayalam, Hindi, uh, Tamil also okay. I think the rest of the language Dr. Jasul will be saying, I think I can handle these languages, no worries. But yes, please feel free to say your thoughts, your comments, or however you feel about this course and what you're looking forward from this. Anyone, Dr. Divya, I can see a couple of doctors here. Dr. Akila, anyone please come forward. I can see Dr. S. Pujasri. Anyone? If you really plan to join this course, means this is one thing which we really look forward, where we have very, very active discussions. So I uh, encourage you to come forward, speak up, say what you are expecting. Dr. Neetu, anyone?
Yes, actually the communication is also important.
Very much important, so that we'll get to know you, so we understand what are your requirements.
Yes, as
You can
I,
even post it in the chat. If anyone want, you can post it in the chat, or it would be very good if you would like to unmute. And I think unmute option is enabled, right? Are you able to unmute?
Good
yes,
evening.
yes, Dr. Manisha.
Good evening, ma'am.
Good evening. Good evening.
So, Dr. Manisha, what I'm expecting from this course is usually when we take this Tridosha, Vata, Pitta, Kapha, it's there, and we have to give diet according to their Prakriti and Vikriti. And when you take it in this modern aspect, it comes like protein, carbs, fats, and it is so confusing. Like, how can we suggest a diet to a patient who is having Vata Prakriti, and which food, fruits, vegetables are suitable for them? And so we have to correlate both Ayurveda and modern terms, and we have to give a planned diet for the patient so that it should not jinx the problem or make it more complicated. So it should be easy for them to take. And just simply, if we say we have to take, you have to take iron, you have to take vitamin D, you have to take vitamin B12, it doesn't work like that. You have to give a very proper diet. So I'm looking forward to understand these concepts in this course.
Completely agree, Dr. Manisha. As you said, a generic diet without any, because most of the patients who come to us, they clearly know about the calorific value. They know this is having more fat, this is having less protein. If you are into more protein diet, so they know these aspects. But the fact that suggesting cucumber and rose salad for an amlapita patient on an empty stomach is not valid. This we know as Ayurveda doctors based on the Ayurveda principles we know. We know about Agni Mandya. We know about how to correct the Agni first, right? So how to merge this Ayurvedic knowledge of Aharaviti along with the nutritional concept. Exactly, that is integrated diet planning. This would be taught to you clearly in our sessions.
Yes,
And you will be able to give your own diet. See, framing a diet pattern, designing it, we will give you the guidance, and you can, as per your prescription model, you can frame it anyhow. So we ensure that you don't give the clients not the calorific value or just the diet intake as protein, fiber, but integrate Ayurveda principles and understand the dosha predominance, as you said, dosha, prakriti and vikriti, along with the modern principles, and convey this in layman's language. We can't say the patient that, okay, now you are having a Vadapitta aggravation, your Agni is there. No, how to translate this into layman's language. This is also important, right? Few may be knowing, but we can't go to an IT professional and say, hey, you're having Agni your AMA is increased, we have to do Deepan Pajan. No, this doesn't work there, right? So how to cut it short to layman's language, integrate our concept with modern and provide them is what we are learning here. Exactly. So you're in the right place, Manisha, I can say, Doctor.
thank you.
Yes, all the best, Doctor.
All the best, Dr. Manisha. Looking forward to see you in our next batch.
Thank you.
Yes. Yeah. Any more questions, doubts? And you can also introduce yourself. You are a practitioner or just completed the VMS or however it is. You can introduce as well. Dr. Manisha, you are a practitioner now?
No, ma'am. Currently, I'm not practicing. I went to training in Trivandrum.
Okay.
Just for 15 days, I went, and they said they'll be posting me in some other center.
Mm-hmm.
And I'm an RD practitioner too. I have
Right.
completed 130 patients.
Great. That's good to know.
I have
So this
completed
would be,
yoga
yeah.
and course too, and now I need diet, but
Great. You're right. Currently in the holistic path, I can say everyone is looking for a holistic approach where you can provide this diet, you can provide yoga, can provide consultations, everything under one umbrella. This is what.
Yes, ma'am. Yes, ma'am.
This
Thank you,
will
ma'am.
really help you. Doctor.
Yes, ma'am.
Yeah, and Dr. Jasul has provided the contact number. So if you have got any queries, anything specific to nutrition course, any course provided from our institution, please feel free to contact in that number as well.
Yes, those who want to join, just send me a message. We will provide you the details.
Yes. And also in the brochures, there is a list of contact numbers. You can always click on that and go contact it. And also try to refer it to as many doctors you know who would benefit from this course or who are currently not practicing or just in the career break or whose clinic is running but not very well. They're lacking some specialization or they don't know why they are not able to convert the leads. Convert the leads, when I say it is more of a technical term, but here it means that convert the leads means a patient comes to us, but we need that patient to trust us, right? Trust is very important. That trust comes when the patient knows that we have the correct knowledge to guide them. That trust we can build only with sufficient knowledge. If they ask me, doctor, what do you think about taking this diet? And if you don't have a specific answer to give, they will just judge you and go and think that, okay, here I don't think I will get sufficient from here, so let me move on. In such a way, you lose your patience, right? So these you can also help, say your fellow members for in this in your groups and colleges and anywhere how this is going to help them. Any more discussions? Anyone want to come forward and speak up?
Yes, as Dr. Litty said, you can just refer to your or inform your friends also. Those who are similar interested friends, let them also join so that you can come together and stay together. It will be a nice experience for you after your college. So
Yes,
you can please refer those who are interested.
Dr. Akhila Devi, you trying to. Yes.
Hello, myself Dr. Akila. I am from Calicut. I'm planning
Hi,
to
Doctor.
join, I am planning to join this Ayurveda nutrition course. A few years back also I am planning, but not at all time. I am not getting the time to start this. But now I am planning. This time, at least this time also I want to join because I am practicing. Since I am practicing 10 years practitioner I am having. I am planning. I understood that if 10-year practice is not sufficient to understand Ayurveda, that not only prescribing the medicine only, we have to prescribe or teach our patient to about our nutrition or our diet, prescribing or that
Yes,
confirm against that disease also we have to maintain or we have to advise some diet to that patient. Then our medicine and our diet plan together and yoga together will come more effect to that patient. That's why I am planning to join.
yes. Thank you, doctor, for saying that. You correctly said it. Always a single path doesn't give a complete result. We can say sometimes yes, sometimes no, but a combined approach, sure. Because
Yes.
currently we know that every disease has a psychosomatic. Most of the disease has a psychosomatic aspect as well. Stress is going to be one of the reasons. So that is where yoga fits in, right? Our lifestyle and our current dietary practices, most of them are staying out of the home or different places. So there, that is where the dietary correction should come. Most of the patients doesn't know about what happens core in their digestion, how this digestion is affecting different organs, how it is going to give an end result, right? So we see that nighttime gym practice, so after 10 o'clock hitting the gym, right? And post that eating high protein diet, leading to massive cardiac issues and massive metabolic syndrome nowadays. This is a currently observed trend. Most of them say that they don't have time in the morning, so they just go and hit the gym after 9 o'clock, 10 o'clock. I really have the clients based on that, and they all are having a metabolic syndrome, I can say, if you take it up. So these are the areas we should come with a better focused diet. And when you were saying that, most interestingly, now what I can see, most of the multinational companies who are into healthcare field, currently who are into healthcare field, and their one catchhold is Ayurveda. Okay. And when they say about Ayurveda, other than the medicines, they are hiring Harvard pass out culinary persons or chefs to make our Ayurveda food items as the recipes I'm saying. Ayurveda recipes needed for specific diet. For these, certain chefs from abroad are being hired who have studied from Harvard. Just think about the situation. Why couldn't we be there? We should be one person there, right? Instead of who studied thoroughly Ayurveda, who did masters in Ayurveda, instead of that, who just have a holistic certification or holistic or wellness certification. There is a course in Harvard, okay, 3 lakh rupees. They provide a 6 month course, a 3 month or 6 month course for holistic care and wellness solution or something said. And they start giving all this stuff. But when I went through their curriculum, I could see that it was very vague. It is not going to hit any of the stones we have learned in our 5 year course. So we should be the person who should stand in that areas. If you're going abroad, we should be the person who should go and say, this is how it works. So yes, learning this, at least these are the basics which we are covering. So at least get to learn this. Then based on our skills, how you present it, how you take it up, these all depends on personal skill. As there are few doctors who recently from, I think the last batch we had a doctor who was from Narva, I think, Dr. Jisur. She was a part of that company, and she's practicing, and she learned the Ayurveda nutrition course, and she's practicing. She's catering the services to abroad clients. Myself, catering the services to all around India as well as abroad clients. So everyone finds their way. So how much you keep on updating yourself, feed in with all the knowledges, and put it together in one frame. It is not that collecting the knowledge and scatter it here and there. How to collect it and bring it to your personal framework. As Dr. Akhila was saying, if 10 years of my practice is not enough to satisfy the patient, means then what else? Then what else is get to know what is, I don't use the word trending, but what is most needed now. So understand that first from a client perspective. And most importantly, what I feel is that currently, if we talk, see, as I said, by giving the symptoms, getting a diagnosis and prescription is there at the fingertip now. If you go to Cloud AI, ChatGPT is another long version I can say, but Cloud Coworker, all those, that gives a clear prescription, and you will be amazed by seeing the response we get from these AIs. Okay. So what is the role of doctor here? If you ask, the only role we are having is how we convince the patient, how effectively you communicate with the patient empathetically. That is where we should be present and hand over this diet prescription and our medicine prescription. So that is where I said counseling a patient is important. So these all areas will be covered during this. Reassure you that. Thank you, Dr. Akila, for saying in, coming in and speaking up. That was really good. Anyone else, any doctors would like to speak up? Anyone else? Any doctors? Dr. Nandini, Dr. Neetu. Dr. I think that's it. Would you like to conclude, please?
Yes, yes. Those who are interested, I put the contact again. Just send me, and we'll be getting you all the details, providing you all the details. So just send me a message in this WhatsApp. So yes, doctor, we can wind up. So hope we can see in these sessions soon. Okay.
Yeah. Thank you all for your valuable time, and thank you, Dr. Jessel, as well. See you all. Thank you.
Yes. Good night.
Good night all. Take care.